you heard little whispers of like, oh, it's called Montauk knee, or
Oh,
you know, like when somebody's knee blew up or
Okay.
they were having these symptoms, but
Okay.
nobody, it wasn't really spoken about.
Right.
Kidney problems, heart problems,
Right.
skin problems, eye problems. I lost my hearing. Like right now I'm wearing hearing aids. Nobody would listen to me. And I kept saying, I'm like 90 years old in a 30-year-old body.
your doctor can be wrong. Your doctor can be wrong, and you have to be your own advocate. LJ, I'm so excited to sit down with you today and talk about your most phenomenal product, TickWise. And I want to start off by giving the viewers some insight into your mission and what really started this drive to get this product out into the world.
So I was really sick with tick-borne diseases. I was sick for over 20 years. I was diagnosed with early onset Alzheimer's, MS, lupus, and I knew it was none of those things. I knew that it all started with a tick bite, and the doctors kept trying to, get me to take these immunosuppressant drugs and I'm going, I can't take those because I know I'm going to get sicker. Started a deep dive into, that was a long time ago.
Yeah.
So there was not a lot of information out there,
Right.
and there was not.
What year was this?
When I
you
got sick,
when you started feeling
2011.
sick. And when you got sick, was it a one day you woke up and you felt sick? Did you find the typical bullseye rash on you that people actually think is so common, but is actually not so common?
I was actually lucky. I
Okay.
did
Well,
semi
right,
lucky.
but you saw a bullseye.
I had a bullseye,
Okay.
right?
Okay.
Very classic bullseye. And I went to the doctor and, let me back up a second.
Yeah, back up. Yeah.
I always worked outside.
Okay.
Went to school for landscape design, greenhouse management. I worked for the Bronx Zoo. My jobs were always outside.
Okay.
I was in tick habitat. I live in East Hampton, New York. So, working for the Bronx Zoo, I was in swamps, literally doing this, looking for turtles. I was always covered in ticks. I never really thought much about it.
Oh, so you always, did you have education on what ticks were?
Not really.
When you were growing up, did someone say, this is what you have to watch out for, this is what they look like,
Never.
this is how you check yourself? Never.
Never.
And you grew up on the East Coast?
Yeah. I grew up on Long Island,
Right.
and my only encounter with a tick up until that point was my friend Sabrina in like first grade found a tick in my hair when she was braiding my hair.
Okay.
And I went like running to the nurse and they
Okay.
pulled it out. That was
Okay.
my only encounter.
Okay.
But moving out to the East End, working on golf courses, working and landscaping, working for the Bronx Zoo and in a turtle study out there, I was covered in them, but still didn't have the education, right? Of like what a tick could actually do to you. That nobody spoke about it. You heard little whispers of like, oh, it's called Montauk knee, or like when somebody's knee blew up or they were having these symptoms, but it wasn't really spoken about. When I was pregnant, I wound up with a ring that went from my thigh through my belly button and around. And I was having a lot of symptoms. Felt like burning sensations, like half of my body, numbness. And the doctor kept saying, oh no, it's because, you're pregnant. It's putting pressure on your nerves and your spine. And
no one would ever associate pain with tick-borne illness at this point.
correct.
Was, right.
Correct. And I had this ring, which just kept getting bigger.
And
right?
Still they did.
And the doctor said, oh, well, you're pregnant anyway. You're not really having any symptoms.
Don't treat it.
We're not treating you, which caused a whole host of
course,
problems after that.
Yeah.
My daughter was born with heart problems, kidney issues. She was colicky, for lack of a better word. She was miserable all the time. I felt terrible for her.
so sorry.
Yeah, well, it was really hard.
Yeah.
It was really, really hard. And I was having symptoms, and I kept going to the doctor and saying, I'm so tired. Oh, that's because you're a young mom. Oh, you have 2 young kids. And I'm like,
It's hormones.
it's hormones.
Right.
It's this, it's
The
that.
gaslighting,
Night sweats. And they're like, oh, early menopause. And I'm like, like, what?
Right.
what?
Right.
Like, I mean, soaking night sweats.
Now, did you know innately? Now I know I also have a son, so I know what it's like to be a new mom. But did you have a feeling that something? Did anything ever scream out at you? I need to treat this immediately, and no one will help me, and no one will listen to me. I'm on a lone
Yes.
island. Okay, and that
I
must have
felt
been really
like I was
hard.
crazy, like going to the doctor all the time. I'm like, oh, now my knee is swollen. I've had 13 knee surgeries
Oh my God.
with 3 replacements because the 1 replacement didn't take. So I've had total knee replacements. Like I'm like bionic woman, like total knee replacements. And still they weren't, I've had both wrists done. I've had shoulder problems, back problems, kidney problems, heart problems,
Right.
skin problems, eye problems. I lost my hearing. Like right now I'm wearing hearing aids.
Right.
So I lost my hearing, but nobody would listen to me. And I kept saying, I'm like 90 years old in a 30-year-old body.
Would you go to these different doctors and say, I had a bullseye rash, it was untreated, I was pregnant, I think we need to retest for, would you push the
Yes.
testing? And would they give you the Western blot test? For which people who are listening, the Western blot is the standardized testing that your functional practitioner will give you, but it is very outdated and it doesn't test for all co-infections, which are, if not worse, just as bad as Lyme disease.
And it also doesn't test you for the bacteria. Everybody thinks so.
Correct.
It tests for the bacteria.
Right.
It tests your immune response to the bacteria.
Correct.
And
It's a joke of a test.
Lyme is an immune evader.
Correct.
So now we're testing your immune response to a disease that your body isn't even recognizing.
Exactly.
So, of course, those tests are incredibly inaccurate.
Right.
Right? So now I was sick with all of those things.
Yeah.
And then I get pregnant. I have another bullseye. We live in Amagansett. We're in a
So
beautiful...
how many years apart is this?
Well, figure I was working outside my whole life. So, I would get my period and I would get a fever. And everybody's like, oh, there you go. Of course, you
You're
have
being
a fever. And you
dramatic.
get,
Right.
I would have relapsing fever. I had symptoms of Lyme disease that would wax and wane for years. Getting pregnant with my son kind of set off a whole more prominent things.
Okay.
Then getting pregnant with my daughter and getting bit and having a bullseye set off even more. So like alarm bells are ringing for me for years. Like, what is wrong with me? But really when I was pregnant, and then to be told, you're fine, you really don't have any symptoms, even though I had been to the doctor for so many years with so many symptoms.
Nothing was validated.
Nothing was
taken
validated.
seriously.
So she was born with all of those things.
Was she born, were either of your children born with Lyme disease?
My daughter was born with Lyme disease.
So when you were pregnant, your daughter's older, right?
She is, she just turned 20.
Oh, wow.
Yeah.
And when you were pregnant with her and you had the bullseye, did you ever ask the doctor, can this be transferred in utero? Was that ever spoken about?
It was
never
not.
spoken about.
It was never.
And I think
it was
that's
terrifying to look back at that.
It's terrifying. And I know in my journey, I had my son and I wasn't diagnosed with Lyme post-delivery. I, at that point, had no idea that I had chronic Lyme, that it had been in me, and I felt fine at the time. But that was one of the reasons that I was hesitant to get pregnant again. And I didn't end up getting pregnant again. And looking back, that's okay. I was so nervous that I kept saying to myself, how horrible would I feel if I passed this on to live with this horrific disease? And there's not enough testing right now. If I think I'm correct in saying the only way to test is through the umbilical cord fluid after the baby is out. That's what I was told by my doctor. And they said, until you're really truly in remission, there is a chance you'll pass it along in utero. And a lot of my clients ask me, if they're going through Lyme and they want to have another baby, should I or shouldn't I? And it's a really hard conversation because it's such a personal choice, and you might not pass it along, right?
Or you might.
And looking back now, I know that if I would have had a second child and that child was born with Lyme, they had a mom who would be so equipped to deal with that. Like who better to manage that than someone who's now devoted their life to learning about this disease? And same with you.
Same with me.
You're the person that, would be able to handle that. But I think that's something that's so important that people don't talk about enough is that this disease doesn't just affect you.
No.
This disease, if you're pregnant, not only could affect your child, but it also affects everybody in the family. It strips you of your identity. It strips you of the decision making because you have this brain fog and confusion and exhaustion and loneliness
and your confidence
and your
strips you,
confidence and
like all of a sudden you're like,
different
I don't know how to drive right now.
Exactly.
Like,
I
terrifying.
couldn't drive either for a while. So I know exactly what you're going through. And I think it's so important to share your story because it's still such a controversial disease.
Yeah.
Right? I got diagnosed in 2020, so not that long ago. Back in 2020, I had over 30 different doctors tell me I didn't have Lyme disease. And these were considered to be the best doctors in the country. I saw the head of infectious disease at all of the top hospitals in Boston. Okay, I spoke to top doctors out of New York City.
Sounds so familiar.
All of us have this thread that connects us because we're all on a lone island and we're forced to figure this out ourselves. And I want people to know, like you said, don't ignore your symptoms.
Yeah.
Don't ignore the feeling inside that something is wrong. And I, like you, was told you probably have MS, you probably have lupus, you probably have some form of cancer, you have atypical migraines. It's not common. That's what's causing this. You have all of these neurological, dysfunction that's going on. It's from anxiety. It's from depression. Yeah. And you're sitting there.
You're causing it.
Exactly.
Like, I'm causing myself to have fevers.
Exactly.
Like,
Exactly. Exactly.
Making myself have fevers.
No. And so I want to hear about your journey to find out that you were diagnosed properly and what you did and what that feeling was like for you, for someone to validate that and how you proceeded.
I could probably
cry,
tear up now.
Same.
Thinking about it.
I know.
Well, when my daughter was about 3, I wound up with another
bullseye.
Again, very lucky. Went to the doctor. They put me on antibiotics. Within 24 hours, I couldn't speak. Right? So I was having what I now know is a Herxheimer reaction.
Can you explain that to people who don't know what that is?
So it's the die-off. So when you take antibiotics, you have this die-off, this quick flooding die-off of all the bacteria. Not all of it, a lot of it. And your body becomes overwhelmed. And it creates these really intense problems, a lot of neurological issues, a lot of, vomiting, sickness.
It's like the worst flu you've ever had times a million. Like
Correct.
The flu is a walk in the park.
Correct.
And it's all the time.
So I went to the hospital because all of a sudden
you didn't know what to do. You were scared. Yeah.
I knew it wasn't a stroke because I was an EMT at the time.
Oh.
So I knew it was neurological, but I knew it wasn't a stroke because it was multi-sided.
Did you think in your head this is a reaction from the antibiotics?
No.
Because it was so severe.
I was like, still nobody was really talking about it.
I know.
So I was like, this is really, really bad. Went to the hospital. They were asking me questions. I couldn't get the words from my brain to my mouth.
So scary.
And they admitted me, did all sorts of tests. And I came back within, I was there for a week, probably the 3rd day there. The neurologist comes in and he's like, I'm really sorry to tell you this, but you have MS. And I had lesions in my brain. I have demyelinated areas in my brain and lots of them, not a small amount. Not like a few.
And he knew you were on Doxy. I'm assuming you were on the Doxy.
They took me off Doxy.
But they knew you were on it for the tick bite.
Correct.
And there was no connection for them there.
And I said, no, this all started with the tick bite. And he said, nope, ticks don't do this. Lyme disease does not do this. And I'm like, well, something is really wrong. Like I couldn't, my head felt like it was going to blow off my body. And they were like, yeah, so I had no other symptoms of MS before this until the till now I have a ring. And like he couldn't explain it to me.
And when you hear diagnosis MS, your world stops because I know from someone who went through it.
Stops.
I was put in an MRI machine for about 4 hours.
Yeah.
They couldn't figure out what was going on with me. They had to sedate me because the anxiety was through the roof.
I was
hysterical.
just sitting there, and I'm not an anxious person.
Same.
And I was just sitting there
so
crying,
helpless.
and they kept checking in on me. Are you okay? I'm like,
you're like, no,
nope.
I'm actually not
Nope.
okay. And I totally validate what you're saying. Hearing the words, when I heard MS, my entire world, it was like the movies where everything, I mean, it is such a scary, MS is such a horrible, debilitating disease. And it was such a moment. And it was also so shocking because one day
3
you're
days ago, I was fine.
Exactly.
Like,
and that's what's so scary. So, okay, so you're laying in the hospital bed. I'm so sorry, ma'am. You have MS. What do you do?
Oh, I started crying, and the poor woman next to me, she's like, oh, and he walks out, and she's like, oh, honey, that was
bad.
awful.
That was
and
bad.
I'm like, I call Chris, who's my husband at the time. He's still my best friend.
Yeah.
We
love you, Chris.
Yeah.
Yeah.
Call Chris.
Yep.
And apparently he like almost collapsed at work when he, I was like, I have MS. So I really didn't even know what MS was.
Right.
Like I, never.
Right. You just knew it was really, it was really
bad.
scary and really bad. Yeah.
In the process. So, like now let's skip a couple of months. I'm still in really bad shape. That was May that happened. Chris comes home one day and says, look, I have a tick bite. And I pull the tick, and within pretty quickly, like we were watching the tick bite, and about like 5 or 6 days later, he's got a classic bullseye. I'm like, Chris, you need to go to the hospital. He owns restaurants. He's like, no, not going. And I'm still with this diagnosis of MS, right? Knowing that it started with a tick bite. It starts this whole like kind of spiral for me of going, this is the doctor's forcing me or trying to force me to take MS medication, and I refuse. He drops me as a patient.
Wow.
Because he's like, if you don't take the medicine, I can't continue seeing
right.
you. And I'm like, no, this has to do with the tick bite. And he's like, no, you're wrong.
And had you been tested for Lyme disease at this point? Like a proper test for Lyme disease to see what co-infections you had?
They tested me with the normal
Western blot.
blot, and it was negative.
Okay.
3 of you have to have, the 5 proteins in order for it to be out of the 10, in order for it to be a positive test. I tested positive for 3 of those proteins, but not enough under the CDC criteria.
And just for people listening, I tested negative 5 times.
Yeah.
Okay.
I will always test.
a trillion infections.
Yeah.
So,
Yeah.
okay. So Chris has the bullseye. He won't go to the doctor.
He won't go to the doctor. He's running restaurants. He's
busy.
like, I feel fine. It's not a big deal. Here's the interesting part. What happened with him? H1N1 was a thing going on then. My son had atelectasis, which is a sticky part of his lower lungs. So he was constantly developing pneumonia. We were treating it as if it was asthma. It was the only kind of treatment to help with the atelectasis, right? So he doesn't continue to have, doesn't continue to get pneumonia. Chris went, and after this, he had a chronic cough and kind of a chronic.
Chris,
my ex-husband,
had the
best friend.
He had the chronic. Okay.
Had this after this tick bite. Had this chronic cough and this chronic cold. Fast forward, that was July. Fast forward to October, it's H1N1. The doctor suggests that because my son could not get the typical shot for H1N1, or I think it was actually in the nose at the time, but it wasn't available in the form that he could get it, suggested that the rest of us get inoculated for H1N1.
Okay.
We all did.
I know where this is going. It woke everything.
For Chris, He wound up not being able to walk and talk. And over the course of a week, I kept going to the doctors and saying, and let me preface this by saying, we went to get the H1N1 shot from the doctor. And I said to the doctor, he has had a chronic cough since a tick bite, and chronically not feeling the best. Is it okay for him to get this shot? And he said, of course, please. He just,
So this is so frustrating and mind-boggling to me. And I want everyone to hear this. I want everyone to stop and hear this. Your doctor can be wrong. Your doctor can be wrong, and you have to be your own advocate. For you to go and tell him this information and for it to be completely disregarded, you should feel safe going to your practitioner. You go to them when you have a problem to take care of you. People ask me all the time, why don't doctors know about tick-borne illness?
nobody's teaching them. It's not
Do
mandatory.
do you know how long the courses that they take during medical training? Because I spoke to a few doctors about this.
I know that in a neurology book from a neurologist, it's a page and a half.
It is
In a 20-pound
it is
book.
a chapter.
Yeah.
It is a chapter, which is, I don't know, a class. They said it was like an hour and a half. It was a chapter. Tick-borne illness happens only spread through ticks from deer. This is what they were taught. You don't have Lyme disease unless you have a bullseye rash. We know now that that is false. And the statistics I was given on that was 20% or less of people show the typical bullseye rash.
Yes, true.
If you are bit by a tick, you take a 10-day course of the antibiotic doxycycline, and you never have to think of it ever again.
Well,
This is what they're taught.
let's talk about how closely related, and then I'll get back to that story.
Yes.
But let's talk about, if we're bringing this up, how closely related Lyme disease is to syphilis.
Yes.
So I know you know this, but
I know
we'll
this.
have this conversation
Let's go.
anyway.
Yes.
But Lyme disease is more closely related to syphilis
And yep,
genetically than you and your first cousin,
it's crazy.
right?
It is crazy.
We treat syphilis for 6 months with multiple antibiotics. We treat, and by the way, not that there's anything wrong with community college. I went to one, but syphilis went to a community college and Lyme disease went to Harvard. It's considered one of the most intelligent bacterias known to man at this moment.
Can you explain to people how Lyme disease evades testing, how it hides in the body?
It has 3 separate forms: L form, C form, and regular form. I forget what the other one is. It also lives under a biofilm. So the biofilm really protects it, the onslaught of the bacteria.
Because so many people say, why
the antibiotics, I'm sorry.
why wouldn't I show positive on a Western blot? Because the type of testing you need is so specific, because the spirochete are so smart and so intelligent and evasive, and they hide. So
They hide in white matter too.
Exactly.
They're not like other.
Exactly.
It's
So
not
it's not simple.
let's compare this to strep throat for a second.
Yep.
Strep throat. It's streptococcus.
Streptococcus. Yep.
Lives for 20 minutes. Lives, breeds, and dies in 20 minutes. But yet we treat that infection for 10 days because it's a mathematical equation.
Yep.
Right? You want to hit the first, all its subsequent, for lack of a better word, babies.
Right.
And so mathematically, they have figured out that if you have this infection here, it is bred this many times and it will live for this long, all of them. So you need to treat it for 10 days. Lyme disease lives for 28 days. One bacteria.
One. Right. That's just one.
One.
Right.
Lives, breeds, and dies
Right.
in 28 days.
Right.
We're not even treating the first life cycle with that 2 weeks of antibiotics.
Correct.
Right? So any doctors listening, if you talk about this just logically for a second.
Exactly. It's science.
It's right.
And you know what? What's so some schools of thought will say that they don't even believe in antibiotic treatment. I know a lot of doctors that I've worked with before who believe herbs are a much more practical, gentler way to go, which for me, I had to go on an antibiotic. I had toxoplasmosis on top of the co-infections and the Lyme. I've been on the antibiotic before, but I also treated with herbs for 3.5 years after that. And I have clients sometimes who are so sick that they can't tolerate the antibiotics. So I want people to know that if you are listening to this and you know that you're in a dire state,
Right.
anything is affecting you, you're so sensitive, there are ways to treat this disease herbally and naturally.
And everybody has their own course. Lyme disease is different for absolutely everybody.
Everybody.
So it's really it's what you choose. I will never. For me, antibiotics, I was able to tolerate them.
You said you had diaph, but you said you knew it helped almost immediately, right? Like you felt it working.
When the oral antibiotics took a while.
Yeah. Oh, you did IV too.
Yeah.
Yeah.
So the oral antibiotics, it was a lot longer process.
Right.
I also had Babesia and Ehrlichia. So
what a combo.
So Babiosis, I'm drinking yellow paint, which is an anti-malarial medication. That's the only way to treat that. And so I would switch. I wound up finding a great doctor.
Good.
There's a long story with that as well. In Mount Kisco, New York. And can I give him a shout out?
Of course.
Dr. Cameron was amazing.
Dr. Cameron,
We
love you.
Saved my life. Like totally saved my life.
Great.
Let's go back to when you said
when you
were finally validated. When I called the office the first time and I started spewing of like first of all, she was listening to me. She wasn't just saying, she
wasn't disregarding you.
Yeah. And then she's like, yeah, I can get you in. It's going to be a little while, but I'll get you the appointment. And, bring all this. I had gone to Columbia Presbyterian Lyme Center and was diagnosed with Lyme disease and co-infections.
Okay.
Both via blood test, because I guess they did a more sensitive test.
Okay.
And babiosis, and they, after being there for 3 days, they did a whole bunch of cognitive testing on me. And they're like, yeah, you classic. You definitely need IV antibiotics. And I was like, okay, when am I getting them?
Let's go.
And they're like, oh, no, we just diagnose, we don't treat.
Right.
So now I had to find somebody that would take their diagnosis.
And was any of this covered by your insurance? Nothing. We'll get into that after. But okay, zero. Yep.
And thank God I was lucky enough that, I was determined enough to get better. And I was lucky enough to have the funds, although it was a huge kick. It was huge on our
your family. The financials are
financially.
It's horrible.
But we were able to squeak by with it.
Yep.
But going to Dr. Cameron, and he basically, I was on the oral antibiotics and the anti-malarial medication for about 9 months.
Okay.
And I was better. I was about 60% better, which I would take.
Yeah.
But what wasn't clearing up was the brain fog, the, pain-wise, I was definitely doing better.
Okay.
I had lost my hearing. One day I had hearing, the next day just complete ringing in my ears. My hearing was gone, and it was never coming back.
So sorry.
That was hard. It was tinnitus, and my favorite thing is hearing birds outside and the spring peepers and my kids, and I couldn't
Were you
hear that.
completely like?
I am like 75 to 80% deaf in my left ear and almost completely deaf in my right. So about 93%, I think, with the last hearing test was.
Sorry.
So hearing aids don't really help. All you hear is the background noise.
Yeah.
You don't really hear anything that you're supposed to hear. So that was kind of devastating, but, I'll take it.
Right.
But then I went on the IV antibiotics.
Okay.
And I had a PICC line inserted.
Did This is through Dr.
Dr. Cameron.
Cameron did all of the treatments for you. For
I'm
anyone
not
who's
sure if treatment has changed with him,
Okay.
so I don't want to.
But he was your guy.
But he was the guy, and I
Okay.
was really sick, and he knew I was really sick. And my first appointment with him, I just cried for. I
Hours,
was
I
there
know.
for 2 hours with him.
Because, and this is important, this is the first time where someone is not only treating you properly, but they're not gaslighting you.
No.
They're not telling you you're crazy. They're not telling you you're fine. They're not minimizing your symptoms. They're validating everything. And I think for me at least, that's when I started healing.
Yeah.
Because that's the minute that I said, okay, I don't have to do this anymore.
Yeah.
I can be safe. Someone's going to take care of me.
I think I cried for 3 days straight.
Yeah.
Like somebody actually
Yeah.
heard me, and I've
Yeah.
been suffering like this for like 20 years. You know, so just having somebody. And
How did you find him?
my Chris's cousin.
Oh, we
kept-
love Chris. Okay.
Yeah, Chris's cousin.
Chris's cousin.
Insisted.
Okay.
She had been down this road as well.
Okay.
She
And
spent
that's
time
usually
out in
what
the
happens
Hamptons.
is that someone, someone's brother's mother's cousin has Lyme. It's never from a practitioner, at least in my experience. Your doctor, your traditional practitioner will never say to you, I know a Lyme literate doctor.
Right.
I've never heard that.
No.
I've never heard of anybody saying, my practitioner said that they couldn't manage this. Let me outsource you to a Lyme literate doctor. You have to do all of this on your own. And when you're in it and you're in the thick of it and you're sick and you're exhausted.
And your brain fog, your brain doesn't work.
Fog, and you feel like you're dying from the herx.
Yeah.
It's exhausting to then have to go and find a good doctor. You don't want to just find a doctor, because you don't want to have to do it again. You have to find the doctor. You have to find the person.
I mean, I had knee doctors.
Yep.
I had, what are they called? I can't even remember.
I don't know.
Orthopedics.
Yeah. Oh, yeah.
I had skin doctors. I had kidney doctor. I had a heart doctor. I had eye doctor. I had
Your life
ear,
revolves
ear, nose, and throat doctor.
around the appointments.
Like the weirdest things were happening to me. I had neurologists. You name it, I had the doctor. I think the only thing I didn't have was a podiatrist, right? But and they're all telling you different things. They all want to put you on different medication. And I knew
You knew.
that antibiotics were the only thing that was going to help me, or something else. But nobody gave me another option.
And I think that that's also a really good point that you bring up, because in our culture, I don't think we're taught to listen to ourselves. I think that from a young age, we're taught to follow instruction and listen to your doctors. And we are the best doctor we can have, because our bodies will give us like symptoms and signs, and you will feel organically and naturally when something is right for you. So how you knew antibiotics were right for you, I knew the second they were wrong for me.
Right.
I was on them for 3 months, and I just knew I could no longer. They didn't serve me. They did their purpose. I thanked them, and we kept it moving. And then I went to herbal. So I want people to know it's okay to listen to yourself and give yourself more credit.
Correct.
Right? Give yourself the credit and the authority to guide you in your healing process, because
everybody's journey is different.
Everybody's journey is different. You and I could have the exact same strains of Lyme and co-infections, and we would respond completely differently. I never had any joint pain. Mine was neurological and the exhaustion and the fatigue and the flu. But I never had the joint pain. And I know people who had the same co-infections that I did, and they had insane joint pain.
Yeah.
So listen to your body. I think that's a really important point.
Yeah. For me, it was working.
Yeah.
And
that's amazing.
I had the ability to keep going, and I was getting better. And then finally I said, but what are we going to do about this brain fog? He goes, probably IV time.
Can you tell people a little bit about what it's like on a daily basis for someone who has the brain fog and I want you to talk about the neurological stuff that you went through, because it's not all just physical, right? No. People associate Lyme with, like we mentioned, the joint pain and the fatigue, but I don't think people talk enough about the brain fog, the exhaustion, and the neurological. So if you don't mind sharing some of that.
So the neurological symptoms are real. Besides the feeling like there's bugs
Tingling,
crawling
yeah.
under your skin, or there's constantly a hair on you, or and besides the brain fog, like I worked in a pre-K and we had 18 kids, and I couldn't figure out how to put them at 3 tables. This was an everyday event, and every day I couldn't figure it out. I'm like, what am I like?
You're like a
It's
zombie.
embarrassing.
I know.
But besides that, there's so much psychological that comes with it. Not only because of the gaslighting. Everybody's like, oh, you're depressed because of the gaslighting. I've never spent a day depressed in my life.
Same.
I've had like moments
Situational,
like,
but not chronic.
breakup or
right.
nothing ever
You
chronic.
seem like a very positive, happy.
Yeah. And then all of a sudden I started having these psychological, I was depressed all the time. I had rage issues.
Oh yes,
Like,
yes.
Like something
Short
would happen and
circuit,
I would
yes.
like rage out, and I'm like, and within the next second I'd be like, I don't even know where that
Just
came
happened.
from. Like,
Yeah.
what was that? You so many like just weird psychological things that I just never experienced before.
Was this for you? Because I know with my neurological symptoms, I was petrified.
Scary.
And I was very scared to tell the doctor the things that I was experiencing.
Well, because they're already telling you you're crazy.
They're already telling you you're crazy.
They're already
and
telling you
I
you're
was
crazy.
scared they were going to send me to an institution.
Yeah.
Did you feel like that, where you had to hold in
Absolutely.
all of the scary things? Would
Absolutely.
you mind sharing some of the things that you experienced?
I had auditory hallucinations.
Same.
Which were very bizarre, but I had lost my hearing. So how am I having auditory hallucinations, right? Like, there were just really feelings of I just shouldn't be on this earth, which is something
like doom, right? Like doom.
Yeah.
Just doom.
Yeah.
I know.
Like never a stitch of joy in the day. But, there were, the neurological part of this disease was more terrifying than anything else
100%.
I could, sleepless nights, bad dreams. You're exhausted
Oh my
all the
God, the
time,
bad
but you
dreams.
can't sleep.
The bad
The
dreams.
dreams.
The dreams are so crazy.
They're so
Yeah,
intense.
they're so
and they're
intense.
so terrifying. I can still remember a lot of them today.
Terrifying.
Terrifying.
And you wake up. So for me, I don't know if you had the same. Mornings were the worst for me. I don't know why. I did have the dreams, but they never woke me up. I wasn't one of the people who suffered from
Insomnia.
rest. No, I
did.
slept. You did. It's awful. I have a
awful.
lot of clients who do, but that wasn't my thing. I would wake up in the morning and the doom and the anxiety and the terrors, like all of the night terrors would come back from the night before. And it was, I couldn't get out of the bed. I was almost like glued to the bed, and I had to
I've heard this.
peel myself. And you don't even know why you feel like this.
Right.
And that's the fear. And
It's-
it's petrifying, and you're scared to tell anybody this.
Yeah.
And then you pair that with the hallucinations. You had auditory hallucinations. I had visual hallucinations. I had suicidal ideations that would come out of nowhere.
Right.
I would be driving, and all of a sudden I'd be like, I wonder what it would be like to drive off this bridge. And then I'm like, what?
Yeah.
What? Where did that come
Just
from?
a kind of like
Roller coaster, the biggest
yeah.
roller coaster.
And then you're like judging yourself
Yes,
for having
yes,
those.
yes.
Like, why?
Why did I think that? Why did I feel that? How did that
Where
happen?
did this come from? This is never
This is
something
not
I
me.
would. This is
not me.
Something's taking over my brain. I literally felt like something was
Yes.
living inside my brain.
You feel like there's an alien inside of you.
Yeah.
And the isolation that comes along with that is as bad.
Because you feel like you're going crazy.
You feel like you're going crazy. The doctors are telling you you're going crazy. No one understands.
Nobody's listening.
No one's listening. Your family is falling apart around you because they're like,
Correct.
what's happening to mom?
Yeah.
You can't be a
Correct.
friend. You can't be a mom. You can't be a wife. You can't be a daughter. You can barely make it through the day.
I would come home from working in the pre-K, And it was all I could do to get myself. My poor kids were making peanut butter and jelly sandwiches.
Right, because
for-
you
for
couldn't do dinner.
I could
And then
not.
there's the mom guilt.
Yeah. Oh,
and
yeah.
that's like a whole
Oh, that
that's a
was
whole
terrible.
other horrible symptom of this disease. Your identity is stripped from you.
Yeah.
And then on top of that, you have to go every day to get your treatment. Or if you're doing herbs, you have to remember how to count the herbs and how many do I take and do I take this with food. It is exhausting.
It's exhausting.
It's exhausting.
Yeah.
And so I'm glad we talked about that because people don't understand that it's not just a bullseye rash and a fever.
Right.
If you're lucky and you catch it, maybe that's all you're going through. But there's so many people suffering for no reason. And it seems to me that you took your pain, like I did, and made it into purpose after the suffering.
Yeah.
Right?
Well, I didn't want anybody else to be in that situation. I didn't want anybody to have to go through the gaslighting with doctors. I didn't want anybody. I wanted people, first and foremost, I wanted to explain to people this is true and real.
It's real.
Right? Like,
And it's serious.
and it's really serious. So I wanted to educate everybody, anybody that would listen. I'd be like, be careful in the grass. You just were like, what are you doing? Like, you gotta, no, get out of the
Yeah.
grass. Here's, but I camped all the time with my kids.
Yeah.
Right. So, and I couldn't use traditional repellents.
Right. So I want to talk about this. So during and after you have tick-borne illness, you become very sensitive, right?
Yeah. To a lot of
So
things. Smells,
touch, taste, light, music,
yeah,
sound. I remember the sound for me was really, really, really hard. Anytime my son would yell or even the TV being too loud, I would look around and say, does anybody else feel like we're in a concert?
Too much input into your brain.
Too much input and you're so inflamed.
You're-
And like you, I had brain inflammation as well. And so I needed to stay I needed my home to be like uber calm and chill. And I loved hearing the sound of chimes. Like those were the frequencies that were working with me. Now, talk to me about, you start healing from the antibiotics.
Well, I wound up on IV.
You were on the IV.
Within 3 days, it went from like in the Wizard of Oz when it's black and white and it goes to color.
You're right.
Like,
You're like a new person. You're
literally,
reborn.
I was like, oh my God.
You're reborn.
Reborn. That's actually a great way of saying
I
it.
felt the same way.
I've reborn. I was
And
like,
you almost forget how sick you felt,
I was suffering for 20 years.
and you become used to it.
And yeah. And so
Yeah.
by the third day of this IV Rocephin, and I had made great strides with the oral antibiotics, but by the third day of this Rocephin, I was like,
Oh my God.
where
have
am
I
I
been?
back?
Like, you're back, yeah.
Where have I been for
Right.
20 years?
Right.
You know?
Right. And you said to yourself, okay, I don't want anyone else to go through what I just went through. Talk to me about your origin story of this amazing product, TickWise. I want to know what was the moment you realized you wanted to create this product and the why behind it?
So I couldn't use traditional repellents
'Cause you were too sensitive.
Because I was really sensitive. They're neurotoxins
Yep.
to begin with,
Yep.
right?
The
And
DEET, for people who don't know, DEET is a megatoxin.
yeah,
Yep.
permethrin,
Yep.
megatoxin.
Yep.
Yes, will it take care of ticks?
Right.
Sure.
And for people who don't know, permethrin is a toxin that you spray on your clothes. It's not supposed to be applied to the skin.
Correct.
It goes on your clothes if you're going camping or you're going to be in the outdoors. Usually you treat it pre-trip,
Yep.
from what I know about it.
You have to let it
You have to let it air outside.
for like 24 hours.
Correct. And then you put it on, but you don't put it on your body directly. But
Right.
it is a harsh chemical, the permethrin.
Correct.
Yeah. Okay.
And your skin's touching those clothes.
Right.
So
Right. So you said to yourself, I want to create something. I can't
yeah,
tolerate this. I
can't
need
tolerate it.
something.
All
Yeah.
my symptoms would come back.
Right.
All,
Oh, that's so crazy.
All my neurological symptoms would come back. I'd start with the tremors again. I would start, with the eye flick. Like all my symptoms would come back, or I'd feel maybe not
crazy.
as severe,
Right. But you could feel it coming
but I'm
back.
like, so what am I
Yeah.
to do? Never go outside again? Like I'm never going to camp with my kids. Like
Mm-hmm.
what am I going to do? I started doing deep dive into essential oils.
Mm-hmm.
And what would repel ticks,
Mm-hmm.
and we started making it my kitchen table. My whole kitchen looked like an apothecary.
And you started making this for you and your family as a very I have to protect my family.
Yes.
And I can't tolerate this. So let me create a product that's not in the market.
Yeah.
That I have found.
Yeah.
And you started a factory in your
Yeah.
house and you said, let's
Yeah,
go.
and
I'm going to
then-
create this.
Yeah. And I
Wow.
just didn't want anybody to be as sick as I was. I couldn't find a natural repellent on the market that worked the way I wanted it to work for as long as I wanted it to work. And that smelled good too. Like that was the other thing. Like they all smelled terrible. I didn't want to walk around smelling
like bug spray. Yeah.
the natural ones,
Yeah.
like even natural. Like I just didn't want to walk around smelling like a cedar forest or, you know, but I also was very hyper. Smells were a problem for me. So it, you know, if it smelled too much of anything, I think I would be like, oh.
And that could start a chain of reactions for you, right?
Yeah.
And just you feel yucky and
Yeah. I could be in bed for another 2 days.
Right.
Like I couldn't, I had already lost
so much time.
of my life.
Yeah.
Like I didn't want to do that again. And I didn't want to never be outside. I went to school to be outside.
And I give you so much credit for wanting to be outside again. This is something I still struggle with to this day. And I'm working with an absolutely amazing healer in my town. And her name is Robin. And she's trying to help me to get past the fear of nature. And I'm still in it. And I'm not going to act like I'm over it. I have a very hard time being on grass. And unlike you, I never had a bullseye. We thought, the story goes from all my testing is that I was bitten as a child and it was dormant.
Probably.
And so I never saw it. But my fear of ticks, obviously, since I was so sick and it was horrible, so much of my life was taken away from me. I have a very hard time being outside to this day. And I'm really trying to work on making amends with nature again. But I give you so much credit for not letting it.
I love nature.
I love you for loving nature. Give me this energy because
the only
I know
thing
it's
I
the
know.
most,
I hate being
the
inside.
biggest healer.
Yeah.
It's the biggest healer in the world. And I just give you so much, you should really give yourself so much credit because so many of my clients are petrified of going outside.
Well,
there's so much PTSD
I
and
can't
trauma.
say I still,
you don't think about it, right?
I can't say that I have to go to that door over there or that, and there's some patch of grass in between. I'm like, for instance, my neighbor and I went to the beach the other day. She went before I did. I like to go to the beach where you could drive on because I'm not
you want to walk through the grass, the tall grass.
Not going through the grass paths, right?
Yeah.
And she's like, "Oh, I'm right at the first one." And I'm like, "Oh, God."
I have to walk through it.
So I get my chair, I get my stuff, walking through. I'm like, "Oh my God, I hate you. Oh my God, I hate you.
know.
Oh my God." I get to the other side of the grass and I'm like, I effing hate you for making me walk through this. I said, I just had such PTSD
and
walking
she probably
through this
didn't
beach.
even think about
She
it,
didn't
right?
even think about it.
She didn't even think about
She
it.
starts laughing at me.
Yeah.
Like,
This
Samila,
is people
this
who
is never happening again.
people
We're
who-
driving.
Yeah, you have
onto
to
the
drive on.
beach.
It's the only way. People who haven't gone through this don't understand the fear and the PTSD. This is trauma.
It's trauma.
This is coming
I'm
back
like,
from war.
I could do it. I could do it. I could do it. And
I know.
of course, I didn't have my spray because I thought
You
I
were
was
driving onto the
on.
beach,
Yeah.
right?
So
you're back in nature. You're trying to you're healing. You're making your product. And was your family supportive of this? Were they like, "Mom, you're crazy that you're making your own tick spray"? Or were they like, "This is so great. I'm so proud of you that we're doing this"?
well,
Combo.
yeah, probably a combo.
Yeah.
Because I'm a little obsessive. I'm like, put it on. You're going outside, put it on.
Right.
Going to a friend's house, put it on. They're like, I don't want to. I don't want to smell like this. I'm like, I don't care.
It doesn't
Like,
matter. And
put it on.
Tell people why it's so important to spray this. Even in the fall, people think ticks only exist starting from May to end of August. That is
Correct.
very incorrect. Will you tell people why it's so important to wear this all the time?
Well, ticks like, believe it or not, ticks like cooler, moist weather. Like the
fall,
this
the
great
leaves.
spring that we had that was cool and moist. And that's why the ER bites are
Through the roof.
through the roof. And fall is cooler, moist, weather. They love leaf litter.
When I see a child diving into a pile of leaves, I literally lose my breath and I'm just like, Like, please, I hope your mom checks you. I hope your mom checks you. I hope your mom checks you.
I have it in commercials. Like when people are running through the
No, thank you.
grasses, I'm like,
Literally. I know. And
I'm like, I can't watch. I can't watch. When is this commercial
it's
over?
a horror movie. It really is. And I think that, okay, so I want you to tell people this should be applied. You suggest that this be applied year round?
I mean, if you're outside, if it's below 30 degrees, you're probably
okay.
safe.
Right.
Anything above
You spray.
freezing, you should be spraying.
You spray.
Especially if you're walking through grass, especially if you're going on a hike. Walking your dog on the side of the road is the worst place. Ticks back up. They won't cross the road. It's too hot for them. They know that there's no moisture there. They won't cross the road. That part next to the road is it's where all the ticks back up.
You're talking about there. You're talking about the grass that
grass
comes
right next to the road. And I drive around with bottles in my car. No, I literally throw them at people. I'm just like, you need this. They're like, what do you mean?
God.
I'm like, just spray it.
Just believe me.
Shake it and spray. Just shake it, spray, and go. Go on. But I still do it because
people don't know.
People don't know.
And what's so amazing about your product is that this is also safe for your dogs and your horses.
Yeah.
And what other creature you have that's going
kids,
outside.
You know?
Yeah, and children, humans and pets. And it's so interesting to me that this, like, you really found a hole in the market. And it's so smart that you created this because this did not exist. And it didn't, I've used a few products that were natural, but they didn't work.
Yeah.
And when I saw your ad, you had this brilliant ad with the mat.
Before we could afford efficacy
But it was
data,
so
right?
good. It was
I was
so
like,
good.
how are we going to show people
It was so
that it
good.
works?
That's what got me. It was like a mat on the floor, and you sprayed the perimeter with tick wise, and you put a bunch of ticks. Not sure how you got them. Did you just go outside with like? Oh, you did a tick drag.
Yeah,
you did a tick drag. You put them down, and the ticks were in the middle of the mat. And the second they got to the barrier where you sprayed your product, they turned right around. Yeah, and I thought that was such an incredible way to showcase.
I knew it worked.
The strength, because the stigma with all natural tick sprays or bug sprays is that it doesn't work,
right?
Which is why people use DEET.
Yeah.
So can you tell us how you sourced and why you chose the ingredients that you chose for this product?
Everything in the product repels, except water.
Okay.
It's the one thing that doesn't repel. Cedarwood.
Yep.
It's great repellent for ticks. Also works for mosquitoes.
Mm-hmm. Yes.
Geranium. Also, ticks and mosquitoes. Citronella, mostly mosquitoes, a little bit ticks, but the citronella really helps with mosquitoes. Peppermint is great for repelling ticks. Lemongrass and rosemary, all very good. The only 3 other things that are in there, 4, is water, vinegar, white vinegar, vanillin, which is an artificial vanilla. You know, it's just like your artificial vanilla, right? Which is not in there for the smell, believe it or not.
Oh, why is it in there?
It's in there because it binds with the essential oils and makes a chemical bond with the essential oils and keeps it on your skin longer, so the repellency rate is longer.
So if someone sprays this in the morning, let's say it's 8 o'clock, I spray this in the morning, how long will this last on my skin?
We have efficacy data that says it's good for 2 hours.
Okay.
100% effective for 2 hours for ticks.
Amazing.
Right. And in order to be registered, so we're a registered natural repellent, which is called 25B in all 50 states, or all requiring states, I should say. In order to do that, you have to prove that you are as effective as DEET at 2 hours.
Now, I want you to say that again because that is mega.
Yeah.
Say that again, please.
In order to be registered, you have to prove that you're as effective as DEET at 2 hours.
That is absolutely phenomenal.
And you can't just put it on a piece of paper and show it that way. They're not going to go for that.
No, you have.
I had to send it away.
I'm sure there was
a laboratory in a blind study. There was no label on the bottle.
It's unbelievable.
There was, the bottle all has to be the same.
It's unbelievable. It's
and they test
unbelievable.
it. I could only afford the testing, the 2-hour testing. I know that it lasts longer, but we could only afford the 2-hour testing. So they tested it for 2 days, 4 times each day. So 2-hour test,
Then
then
you
another
wait, and
2-hour
2-hour
test, 2-hour test, 2-hour test. So it tested 8 hours for 2 days straight. And we are 100% effective for ticks at 2 hours and 100% effective for mosquitoes at 1.75 hours. We are really effective for mosquitoes at 2 hours, but a mosquito had literally put its toe down and flew off again, never bit. And Connecticut is a very hard state to get registered in. They said, nope, you had a landing. We're only saying, and the landing was at 1.75 hours. And that's what we're saying.
Okay. Even that, but still is incredible.
Yeah.
Now, for people who are sensitive to chemicals or people who are in the holistic space, such as I am, I really appreciate this because no one wants their child or their animal or themselves to be doused in chemicals, right?
Right.
Now, if you have chronic illness, whether you have Lyme or not,
Chronic illness
of any kind, you know that your job every day is to wake up and do everything you can to keep your body is in a space of calm.
Yep.
You are eating a certain way. You are living a certain way. You can't use certain products anymore. So to have
I can't use hair dye.
can't
which
use
is
hair
why,
dye,
Yeah.
right? So you're a perfect example of why it is so crucial to have a product on the market that is all natural, but as effective. Why would you ever want to use a product like DEET if you have something that works just as well?
No, I mean, that's how I feel.
It's just so,
but
it's so amazing to me. And also, you are the first product that I have found that is able to be used on my child and my dog. Now, I have products for my dog separately, and I'm talking about holistic. I have some cloths that I wipe him before he goes out.
Right.
But to be able to have one product, that's it.
Right. You don't
For
need 3
everything.
bottles.
You don't need 3 bottles.
1 bottle for a kid, 1 bottle for the adult, 1 bottle for the,
It's unbelievable.
Yeah.
I mean, I have them all over my house. I have them at my front door. I have them in my back door. I have them in my backyard.
Me too.
I bring
Like
them everywhere.
every car.
Every
It's
bag.
in every door in the car.
It's everywhere. And it's so easy to apply.
Shake well.
You shake it, you spray it. I mean, my mailman the other day was outside when I was walking my dog, and he was watching me apply the tick spray to me and then put it on my dog Zeus. And he was like, ma'am, what are you doing? What are you doing? And I told him, and he was like, this is so amazing. I'm outside every single day. I'm walking through grass every single day.
Please give him one for me.
I did.
Okay.
I did.
Please.
I did.
I supply
I
all
did.
of East
I gave him
Hampton.
You
the
do?
postman.
That's so
I do.
sweet.
I made sure that they have one in every truck.
It's so important. I also, at my son's camp, he has a bottle that he takes to camp, and I say, if they let you, if somebody doesn't have tick spray, it's all natural. It's
Right.
I told his counselors. I called the camp ahead of time. I mean, this product should really be sitting everywhere, and
I hope it does eventually.
it's really, really amazing. Okay, so this came out on the market in what year?
2018.
In
we
2018.
started, yeah.
And it's one product for mosquitoes and ticks.
And ticks. And anecdotally, I know it works for lice,
Oh, that's
bed
interesting.
bugs.
Wait, meaning
gnats.
you spray it on your head to prevent lice?
Correct. And on your kids'
Oh.
backpacks.
Oh, this
and
is interesting.
Their jackets.
Oh, wow.
Yeah. So when you know that there's a lice outbreak,
That's a game changer.
it's a game changer.
Oh, I'm going to remember this when
Yeah.
school starts again.
Yeah.
Oh, interesting. Okay. Now, do you have any tips for someone who doesn't have chronic illness, someone who doesn't have any experience with Lyme disease, but they want to know why it's so important to spray yourself every day? Let's say someone says, I live in New York City. I have a lot of clients. That's where the majority of my
I
clients
have
are.
a dog.
I have a dog, or I live in New York City.
Right.
I'm not in the grass. I don't go hiking. What would you say to them?
It doesn't matter. I mean, the New York City is part of the fly zone for birds.
Right. Can you talk about that, please? How ticks travel on other things other than deer?
Yeah.
Okay. Tell us.
I mean, yes, I know it's called a deer tick,
Right.
but birds are actually the most notorious for spreading tick-borne diseases. So
Yep.
if you follow those fly zones, that's where you can see, from Canada to Florida, and everywhere else across the country, those are your major areas for tick-borne diseases as well.
Squirrels.
Squirrels, chipmunks, mice.
Chipmunks.
I mean, you need a mouse in order to create Lyme disease anyway, but there, turkeys,
Just animals.
anything.
I know.
Your dogs,
Yep.
but they're finding them on the rooftops in New York City.
This was the worst outbreak this season in New York City that it's ever seen. And this is not the Hamptons. This is New York City, concrete jungle.
Correct.
Tick bites everywhere.
Correct.
Central Park, like anywhere in the city. And people were really shocked to hear this. One of my functional doctors in New York City said that since June 1, and this was about 2 weeks I spoke to her, so it was midway through June, that she had diagnosed 65 people.
Yeah.
In a few weeks.
Yeah.
And it's scary. It's really scary.
It's very scary.
Right,
It's not as, I think one of the first things it says on the CDC website is it's hard to get and easy to cure. And it's the complete opposite.
That
It's
is,
easy to get and hard to cure.
couldn't be farther from the truth.
Yeah. Yeah. That it's rare. It's not a rare disease.
No.
More people are getting disease every year than live in all of Miami.
I'm convinced everyone has it. At this point, I'm convinced that everyone has some form of tick-borne illness.
Yeah.
Now, when I was diagnosed in 2020, I had a really great conversation with a functional in Chicago. Her name is Dr. Casey Kelly, and I love her dear. She was my first doctor who treated me. And she explained to me that it's not just ticks who transmit this disease. And that was also really shocking to me.
Yeah.
It can come from a mosquito. It can come from a spider. It's not traditionally passed like that. But if you're wearing a product like this, you're just protected all the time.
Yeah.
So for people who think you can only get tick-borne illness if you live on the East Coast, in the woods, Nantucket, Martha's Vineyard, Boston, wherever, that's so false.
Yeah.
So spray yourself all the time, whether it's 40
spray
degrees.
before I go to bed every night because
so
my
smart.
dogs sleep in my room.
I know, same.
So I spray myself. I take a bath every night.
Oh my God, I have to start doing that. I have to start leaving one next to my bed.
I take a bath or a shower every night.
Yeah, and then you spray.
And then I spray myself before I put on my pajamas, and then I spray
After.
myself after.
Oh, that's such a good hot tip.
Yeah. And I travel with
Yep.
the bottle because
And you make little ones that are travels, which is,
yes,
the
that
little
little
ones,
guy.
which is so smart.
But it's great for bed bugs. So
I'm going to have to start doing that before bed.
Yeah. I
even
spray
think
down
of
the
that.
hotel rooms. I do a lot of traveling. I do a lot of,
Oh my God, you spray the hotel rooms.
I spray the bed in the hotel room.
Yes.
Because bed bugs.
That is such a good tip.
Yeah. I don't want to bring bed bugs home.
No. Okay.
I don't want to be bitten.
Okay, that's amazing. That's a really good tip. So can you tell people where they can find Tickwise?
Where 3momsorganics.com.
Yep. And where did the 3 moms come from?
Me,
Yep.
Mother Nature,
Uh-huh.
and the customer.
Oh, I love that. Because honestly, no one is more determined than a mom,
Yeah.
right? No one wants to protect more than a mom.
Correct.
I love that. I love that explanation. And so you can find yourself on your website.
Yep.
Did you say Amazon too?
Yeah.
Amazon?
We're on
Okay.
Amazon as well. Of
Perfect.
course, we're in hundreds of small stores across the country. Always shop small first.
Right.
Love Amazon.
Right.
But
support your local business.
try to help out.
Yep.
Small businesses are going through a really tough time right now. So, it would be great to just make sure
support
that
them.
you just try that.
Love that. Okay, so if for people listening, can you give us 3 things that you wish you knew when you first saw your first bullseye rash?
Jeez.
I know. It's hard.
there's
But if you can think of
so many.
just a few things that someone can take away from this, if they find a tick on them, 3 things that you wish you knew in the moment.
I wish I knew that I could get that sick.
Yep.
I wish I knew that my daughter could be born with it or my children and that you can give it through breast milk. I wish I knew that. And I wish I knew that the doctors weren't going to help me. Like, I wish I knew I had more faith in myself, to believe in myself, and not, we've been told our whole lives that doctors know everything. Oh, they're the smartest, but they don't know everything. What I'm going to be really fighting for, I've been doing some work with Center for Lyme Action.
Okay.
And what I really think, what I am going to be talking about or want to talk about a lot with them, and how can we bring this at least to just New York State. I think every doctor needs comprehensive training, whether you're a podiatrist or a cardiologist
Absolutely.
or neurologist or the EMT that's going to pick up all nurses.
And that is such a good point, because like we spoke about earlier, the symptoms vary from patient to patient. So for example, my first symptom was fatigue, okay? But then that went to gastro symptoms. And then that went to headaches. And then that went to heart palpitations. And then that went to anxiety.
Yes.
So like you said, I saw 55 different doctors. And if they would all have been trained, right?
There should be mandatory CME credits for everybody in the medical field.
Maybe one of them could have flagged this.
Correct.
Right? That's a really good point. So having some form of baseline training on the effects of tick-borne illness, symptoms of tick-borne illness that are not traditional, right? Not the muscle pain, not the bullseye rash,
not the swollen knee,
the hallucinations, the neuropathy.
Yeah. I think every healthcare, whether they're a therapist, a psychiatrist, I've tried to send doctors, hey, I'll pay for you to go to the ILADS conferences. I'll pay for your ticket. I'll pay for your hotel. I'll pay for your ticket, your plane ticket. Please go to the ILADS conference. No, it's not. And some of the best doctors were regular general practitioners that started putting these pieces together and started saying, hey, this person, Joe, had the same problems as Bill and Mary and, Albert. And
there's a pattern here.
A pattern or a link? Like, these are doctors that thought outside the box and that were actually listening to their patients and not just, getting money from the insurance company. Like,
and that's something I want to quickly touch upon, is the financials that come along with tick-borne illness. My dream is that one day everything will be covered by insurance, so everyone has access to proper care. Okay, so 10 days of doxy for a typical patient, it doesn't work.
No.
There's so much more.
You're creating a bacteria that's now immune
to
anything that lived through those 10 days of antibiotics.
Correct.
You've now created
and sometimes it's a slow burn. So a lot of my clients will say, well, I feel okay. I did the doxy. I think I'm okay now. But guess what? They call me in a year. They call me in 6 months.
Yep.
I'm not okay.
No, because you haven't
treated it properly, right?
Haven't even hit the 28 days.
It's the first layer. It's just the layer. So my dream one day is that Lyme disease will be considered as important as any other disease out there and treated with the same empathy and sympathy and kindness and seriousness as any other disease. It's just as people, I don't think that people take it as seriously because you don't die from Lyme disease.
But you do. People do.
And the
daily.
And the links of all of these other diseases are born from Lyme disease. People don't realize, right? So that's part of my dream.
Chronic illness. You wind up with cancer later.
Your body is so burdened.
You can't fight everything all at once.
Exactly. So the financial toll that it takes on your family is horrific.
Yep.
And I always try to help my clients who don't have the access to this. I try my best to give them tools. So some of the tools that worked for me, other than the medications and the herbs, were something called Firefly. I don't know if you've ever done this. This is frequency treatment.
Okay.
And you put it over your stomach or the area of where you're having any show. You put your finger in what looks like a pulsometer, and it gives you a full diagnostic report of all of the frequencies in your body. So this is HPV, this could be AIDS, this could be cancer, tick-borne illness, parasites, anything. and it penetrates the skin and it helps to kill off the parasitic infection.
Gonna have to look
Sweating,
into that.
yeah, they have a great one here. I can send it to you. Sweating was huge for me. Detoxing.
Yeah.
When I could tolerate it. Not in the beginning. My body couldn't tolerate it.
Liver detox.
Liver detox was huge for me. Colonics were big for me. Just expelling all of this stuff. So when you're sick and you have Lyme, everything else kind of slows down. So I stopped my liver, my kidney, everything was a mess. I had a huge parasitic infection. I ended up finding out that I was living in mold, which goes hand in hand with Lyme.
Yeah.
So for people who don't know this, never really just the Lyme, right? It's you become so compromised that something else always creeps in there and then it makes it worse. So cleaning out your body, detoxing your body, also meditation and breath work were huge for me because I was in such a state of fight or flight all the time.
All the time, because your immune system is shot and your nervous system is shot.
Right. So if you could give someone a couple tips on what helped you the most outside of the medication, what would those things be?
Working out through the medication, right?
Oh, that's a good one.
Because the more breath you're taking in, you're forcing that antibiotic into the crevices of where Lyme disease lives.
Okay.
So you need to get your heart rate up and you're breathing heavy to help facilitate that movement of the antibiotics while
And
you're
if
taking
people
it.
can't tolerate heavy sweating or cardio or HIIT classes, do you suggest doing a long walk, something that's low impact, something where
Low
they're
impact,
also getting their heart rate up,
Absolutely,
but
yeah. Heart
something
rate up.
that's
Okay. I mean, I wouldn't have been able to handle that.
Totally, me
right?
neither. But I did walk.
Be patient with yourself. Don't beat yourself up. Everybody else is doing a good job of that on their own. Don't beat yourself up. And it's going to take time. And there is a light at the end of the tunnel.
Totally.
Work at it and you will get better.
And it's not linear. You
It's
can
not linear.
You can feel great for 3 weeks,
Yep.
and then bam,
You feel great for 2 days. And
Exactly.
then the third day, bam.
you're out.
So, try not to take those as setbacks. Take them as, okay, well, I'm gonna have good days again, right? And
Right.
those
Remember
start
those
to
good
get,
days. Right. More and more.
more
The
and
good
more.
days start to happen. So I want to leave everyone listening with prevention tips because I think that's just as important, right? So I want to hear what you and your family do to prevent. So you wake up in the morning, take us through a day of LJ. Tell us what you do.
Wake up in the morning. I actually put my feet on the ground and I tell myself
You
every
go in the
morning,
grass. Is that what you mean by ground, or you mean out of bed ground?
out of bed ground.
Okay. We haven't gone to
And-
the grass yet.
yeah,
Okay.
And I tell myself every day this is going to be a great day.
I love
and
that.
I had to start doing that just because there were so many bad days.
And it really
so
makes a difference.
I think it does.
I know it does. I know it does. Okay, so we have a self pep talk.
Just say it a couple
Okay.
times. I grab a cup of tea.
Yep.
And I start work. I get up somewhere around between 4 and 5 every day.
Okay.
And I absolutely love my job.
Yeah.
I'm really excited about making sure that the product gets out to as many places as it can, into as many hands as it can. I don't want anybody to feel like I did. I don't want anybody to have to go through what my kids went through, what my ex-husband went through, what my dogs have been through. I really shake well and spray and just, I love working and I love getting it out there. And if building a business is fun and it should be fun. And I'm really passionate,
I can tell.
if you don't get bit, you don't get sick, really. I mean, you're going to get sick with something else, but you won't get sick with tick-borne diseases. Right?
Right.
Like,
And this is such the payoff to take your extra 2 minutes or under
Right.
30 seconds of
shake
spraying.
the bottle well because there's no parabens or SLS.
Yep.
We're a made safe product, which we're the only repellent in the world to be a made safe product. And if you don't know what that is, look it up because it's a great certification and it's a very hard certification to get.
It's very hard to get. And so Every day you wake up, we tell ourselves we're going to have a beautiful, good day.
Yep.
Everything's going to be okay. You start your day doing something that you love. And before you go outside, you're spraying yourself.
Oh yeah, well,
multiple times.
I'm an avid gardener.
Yep.
I went to school for landscape design.
Right, so
I
you're
don't,
outside all the time.
I'm outside all the time.
You're
So
spraying.
I spray. It's at the deck before I go downstairs into the grass.
Yep.
I have a pond. I have a koi pond that it gives me amazing amount of peace.
Yeah.
Right. The water running, the lilies growing in it, like just peace, just watching the fish. And before it, just spray yourself. Like just
takes 1 second. It literally could save your life. And it could save your life.
Yeah.
It could really save your life. And and
make memories, not doctor's appointment. I say that all the time.
Yes. Can we make that a hat?
Yeah. Make
That's
memories,
so
not
good.
doctor's appointments. Yeah.
It's so true. So, okay, so take the time, spray yourself, spray your pet. Also,
Well, your dog, not cats.
sorry, your dog. Your
Cats
dog.
lack an enzyme in their liver and
Sorry,
they
your
can't
dog,
process.
your horses.
Yeah, your
right?
horse,
Your
yeah.
horses.
Yeah.
Your
You can buy a
children.
pony now.
You can buy a pony.
Yeah.
Okay, I'm getting a pony.
Yeah.
I deserve it.
Yeah. There you go. Me too.
Okay. And spray inside also. That was such a good tip before bed. Take a shower, spray, get dressed, then respray.
Yeah, I put a towel down because, there are some.
But it will, you're right. People who have dogs like I do, and
Yeah.
I'm all over my dog all the time,
Yeah.
making out with him, not
You
on the
can
lips.
spray
but
your couches.
Yes.
You can spray your outdoor furniture.
Yep.
Doesn't stain your clothes. I've never met a fabric that has
didn't
been
like it.
stained. I don't wear silk often.
Yep.
But,
It's a
I'm sure
multi-purpose,
you would have to
right?
watch
right.
out for silk.
But it's multi-purpose. It's not tailored to a specific.
No, I know people that spray their screens. I actually know.
Oh, interesting.
Yeah. So the gnats don't come in. And I've been hearing this more and more. I have people that use it as deodorant.
Oh, interesting.
Because
it's all natural.
Yeah.
Why not?
so they use it as deodorant. And I
Oh.
started with like a bunch of landscapers.
Maybe that's your next product.
I'm just.
I know it's one product.
That's it.
Right.
But
That's amazing.
yeah, people use it as deodorant.
Right.
It's great after sun, and it's also great if you do get bit. It's great, like with a mosquito bite, you just spray tick-wise on it, takes the itch away almost immediately. And all these things just happened out of
Right, because of trial and error. Right.
Yeah.
So if someone does find a tick on them, which I want to preface, no tick repellent in the world is 100% foolproof. It can happen.
Yeah.
Right.
Well, you can miss the back of your leg.
Exactly. It can happen.
You're spraying here,
Right.
and you miss the
Right.
back part of your
right.
leg.
So if someone does,
You're going to go wherever it's not.
correct, and they're going to go into the darkest, most hard to reach place. If someone finds a tick on them, will you just quickly give us your top 3 tips about what you would do if you found a tick on you or your person in your family?
Get a tweezer, very thin tweezer, pull straight up.
Yep. Don't twist.
Don't twist.
Yep.
Don't turn it. Don't, don't get as close to the skin as
Don't
possible.
burn it.
Don't burn it. Don't
People
put anything.
are crazy.
Don't put anything on it while it's in your body.
Correct.
Right? Like, because all it's going to do is regurgitate
Exactly.
whatever's in its system
Yep.
back into you.
Exactly. So we pull it out.
Pull it straight out, gently, put it in a Ziploc bag.
Yep.
And I send ticks away.
Me too.
Okay.
Where do you send your ticks?
I send mine to tickreport.com.
Okay.
How
I
about
do
you?
the tick encounter.
They're both great.
Amazing.
Yeah.
And I also tell all my clients to apply Lugol's iodine directly on the bite. And I send the tick away to see what it is. And I always recommend, and this could be me being a little crazy, but I recommend everyone get a tick test regardless of how long it was in you, regardless if you have a bullseye rash. Most of my clients don't have a bullseye rash. This one test can change your life.
Yeah.
It can change your life. So I have people who tell me, oh, I was out gardening, I picked a tick off of me, I kept my day moving. Get a test.
Right.
Get the proper test. I have a few tests that I love.
Yeah, tell me
I
about
love
them.
Igenix.
Igenix is
I
the
love
best.
Vibrant.
Okay, we have to talk about
Yeah,
those because
I love-
when
you,
I'm so old
and
at
it
this.
changed-
Like,
even
this has been
since
going
I
on.
started,
Igenix
it's
was
changed.
the only one.
Igenix is great. Vibrant is great. I really, I was recommended recently by one of my doctors, MDL.
Okay.
I'm going to do that one. I think it's really important to spend the money, get the test. It can change your life.
Yeah.
You might not feel sick right now.
No.
You might feel 100% normal until you don't.
Well,
So you might as well know and
I have a
treat
good
it.
doctor friend of mine who says bit in the summer, sick in the fall, or bit in the
Exactly.
spring, sick in the summer.
Yep.
You know, like you don't get sick right away.
Exactly.
Most people don't,
Exactly.
which is why it's also so hard.
Exactly. So take it seriously. Don't burn the tick. Don't smush the tick. Keep
No.
the tick. Send it away.
Yep.
And know what's going on in your body.
Because if you do get sick, you can go back to the doctor and say, I don't feel well. And
Here's what I have.
This is what was in my tick.
Exactly. And those are really great tips. And I just want to thank you for creating this life-changing product, because I now feel so much safer sending my child out into the world. And
We have to get you back on the grass.
we have to get me back
we have
on
to
the
get you
grass.
back on the
We
grass.
have to. It's a work in progress. And I thank you for creating this with such love and honor and passion. And I really hope that everyone hears this and buys this and gives it away as a gift and keeps it in every crevice of their house. And this product is life-changing, and it's safe, and it's effective.
It's effective. We're a women-owned small business.
You're a women's small
We're a
business.
registered natural repellent.
And you are what was the
Made
certificate?
safe.
You're made safe, which is really
We're a
hard.
made safe product.
And to have this product can really save a life. So I just want to thank you for making this, and I'm so excited for what's to come for you.
Thanks.
And
Thanks for having me.
I just can't wait for what's to come.
I love hanging out with you.
Okay. Yay.